A typical visit for a patient coming into the Cardio Wellness Center actually consists of 3 steps. There's an assessment, a time where we make the plan for them and they make it with us, and then there's the follow-up. So a patient will come in, they'll meet with our technician, and during that time there'll be a complete assessment will be being formed. They'll get their weight, their body mass index, their waist circumference, the vital signs, their blood pressure and heart rate, plus multiple labs that we'll recommend, and certain labs particularly for that patient. Additionally, there might be other tests that we would recommend, such as a calcium score that assesses for hard plaque in their arteries, or peripheral artery disease we might assess for, depending upon the patient.
The best test that I recommend for screening is the cardio scan, and that can identify the presence of plaque. And so it can help identify what kind of your risk category would be, if you're at minimal risk for having an event or at a high risk.
Then the patient will meet with a nurse practitioner in a cardio wellness center, and when they meet with a nurse practitioner, together we'll formalize a plan that's customized to that patient and that patient's risks and that patient's severity of heart disease or even peripheral vascular disease.
So we can give them, I think, more time than what their primary care provider could give them, and we can look at the big picture and not just focus on one thing. We identify several risk factors and a lot of education that they may have to go several places if they were going somewhere else, and we can provide that in just one visit.
The most important step is the follow-up. We'll have them come back in 8 to 12 weeks where we'll see, how did that plan work? What do we need to do to tweak it to make it better for that individual and have better outcomes even?
It comes down to a core sort of group of interventions that we do. Sometimes with medications, always with some interventions with respect to diet and lifestyle and supplements, but it's very effective for a broad range of sort of problems and conferring a broad range of benefits to the person.
Some of our patients come, they know they have a family history of heart disease and they want to prevent that from happening to them. So we identify their risk factors early. Others don't know their family history. They want to know if they're at risk for having heart disease, and that could be a heart attack or plaque in their carotids. It could be high blood pressure. And in the process, we identify if they're at risk for diabetes. We can help prevent diabetes. So it's not just heart health, it's other things that can optimize our health and help prevent future diseases from occurring.
When patients come into our office, they get excellent care from our providers, our doctors, technicians, the whole staff. Most people walk out with a smile on their face.